to another video, another vlog. It's officially my first day of my second semester. So I'm leaving McDonald's. I stopped and I got a coffee because for some reason, well, not for some reason, but this morning our electricity went off. Apparently there was like an outage in our neighborhood, so I wasn't able to make coffee at home. Luckily I was able to straighten my hair before the power went off. So yeah, it's my first day of school. Actually, it's not my first day of school. It's my first day of my second semester at school. And I am definitely excited to get this semester over with. Today is August 21st, and I was like thinking to myself, okay, we have like 9 or 10 days left in August, and then it's September. So basically we're done with August, and now we're gonna be in September. So all I have left of school is like 3 months, because we have August and we have September, October, November, and December. So like 3 months is not that bad. So here we go on our adventure for the next 3 months. So I am done with school for the day, and I'm currently at my kids' school. The time right now is 1:30, and my kids get off of school at 1:45, so I'm here waiting for them. Today was kind of an easy day at school. I do have a headache right now, and I think it's because I haven't ate. We had our dosage calculation quiz today, and I think I did good. I think I got 100%. One of the questions I'm a little bit concerned about, it was a input and output question, and I didn't clearly read the instructions, or I didn't read the instructions all the way, so I'm hoping I didn't miss anything. Other than that, it was pretty simple. It took me the whole time though, so we had 25 minutes to do 10 dosage calculation questions, and I'll let you guys know how I did soon. I wasn't able to record just because I'm not really comfortable with the new staff and whatnot, and we have new students in our class, so I didn't want to like pull out my phone and just start recording. I think that's kind of weird. Today we just had labs, so we went over like medication administration. We did some sub-Q injections, and we just practiced injecting. In the actual lab, we worked on phlebotomy, so I was able to withdraw a blood specimen from our little mannequin, which was exciting. I actually want to try on a real person now, and I found out that when we go to clinicals, we are able to withdraw specimen. As long as our instructor is with us, we are able to do that. Guess who got 100% on her dosage quiz? I did. Hey! My first 100% for the semester. And hopefully this semester I can just do better on my quizzes compared to last semester. But yes, I'm so proud of myself. Today is now Saturday. It is 9 o'clock, and I am going to go to the weight loss clinic. I think I mentioned it in one of my last videos, but not this past week, but the prior week, I ended up losing 3 pounds. This week, I didn't go to the gym at all. I didn't eat too bad, so I'm hoping I at least lost 1 pound, or at least 2, 1 minimum, something, anything, because I ate less and I drank more water, and I didn't eat any junk food, I don't think. So yeah. I am going to go to the weight loss clinic and see how much weight I lost. today, the only thing I really have planned is schoolwork, and I need to do laundry, but my dryer is not working for some reason, so hopefully my brother could come today and use his little machine thing to test the voltage in the outlet, because I'm not sure, I don't know what's wrong with it, but yeah, the dryer's not working. So worst case worst, I'll have to just wash my clothes and either hang it up to dry or take it to the laundromat and dry it. But honestly, I'd rather just hang it up to dry, because it's kind of a hassle to load everything in the car and get everything down. So before I head to the weight loss clinic, I wanted to talk to you guys about my lecture this past week. So remember, I did all the pre-work like a week ahead of time, and yeah, so I did all the pre-work a week ahead of time, and honestly, when I had my lecture this past week, I was so confused. And I was honestly a little bit disappointed because, I don't know, I just didn't feel like I was completely understanding the topics, and to be honest, I was a little bit discouraged, but I am trying to cut myself some slack because I haven't really studied how I used to study in block 1. So today our new module got released, but I'm not really going to focus on that until tomorrow, because today I want to finish going over topics from last week that I quite didn't understand, and then I need to start working on my class at ASU, and I seen that we just have like a syllabus quiz due and a couple little things like that, so I'm going to do that today as well, and then I'm going to get my binder ready for my class at ASU, and basically that's it. I'm getting off the freeway now. My hair looks crazy, but I'm getting off the freeway now. I just left the weight loss clinic, and this week I ended up losing 1 whopping pound. So I lost 1 pound this week, and I am just glad I didn't gain any weight. This week I'm gonna try my best to go to the gym, because this past week I didn't go to the gym because I was being a lazy person. So definitely this coming week I'm going to try my best to step it up and go to the gym, and hopefully next week I'll be able to lose 2 pounds instead of 1. Jesus, my hair. Yeah, so hopefully next week I'll be able to lose 2 pounds instead of 1. It is Sunday now, and I am on my way to the car wash because my car is filthy. Well, I'll just show you guys. My car is filthy. So, yeah, I'm on my way to the car wash, and then once I get home, I'm going to place a Walmart order for pickup because I don't feel like going inside of Walmart. So yeah, normally I just do like a pickup order. It saves time. Yesterday I worked on like pharmacology the whole day, so I was trying to understand ANS medications, which is adrenergic medication, and cholinergic medication. I was just trying to understand like the physiologics of like the whole nervous system in general, because I really am not too familiar with it, to be honest. So that's why I was having difficulties with it. So yesterday it took me like half the day practically just to understand how the nervous system works and how it's split into the central nervous system and the peripheral nervous system, and then how the peripheral nervous system is then split into the somatic and then the ANS, the autonomic nervous system. So I It took me a while to understand like how all of that actually works, but I think I got it down now. Um, After understanding the nervous system and CNS and then the peripheral nervous system, and seeing how the ANS is split into either the sympathetic and the parasympathetic, which is your fight or flight or your rest and digest responses. I'm over here like, think, brain, think. Think, brain, think. Oh, Jesus. Lord, pray for me. So, yeah. The sympathetic responses or receptors have medications such as the adrenergic agonist and the adrenergic antagonist. See, look, guys, I'm learning. It literally took me like all day just to have a basic kind of understanding of these medications and how they affect whatever receptors. So yeah, I think I am almost okay with the ANS medications. I also created a Quizlet for the ANS medications because while watching the PowerPoints that the professors gave us, there was some stuff that I wanted to remember, so I would like create a question on Quizlet. It was something like, what is the antidote for botanical? And the antidote for botanical is atropine. Yay! Look at me. And atropine is a think. Atropine is classified as a it's a parasympathetic agonist.
Please don't ask again. Who's up in the fan? Ain't my only fans. I was in my hovercraft, had another laugh. How you roll with them when you know I'm him? Got it on remote control. Got it on remote control. Got it on remote control. Got it on remote.
So moments ago, before I showed you guys the gym, you guys seen the work that I did, the notes I took. Those were the notes I took on Sunday, which was yesterday. So I started my new module stuff yesterday, and the way the professors have it set up is that they provide videos for you to watch first, which is like the prep work. Okay, so then they give you their lectures in a YouTube video that they want you to watch. So they basically give you prep videos to watch to kind of prepare you for what they're going to be teaching or lecturing about. So yesterday it practically took me about 3 hours just to watch the prep videos because I needed help understanding the prep videos because I didn't even know what the prep videos were really talking about. So one of the lectures for the prep video was a video about like fluids. So they talked about isotonic, hypotonic, and hypertonic. So now that I watched that prep video, I have an understanding of isotonic, hypertonic, and hypertonic. And previous to that, I didn't know what that was. I think we touched bases on that last semester, but it really didn't stick. Yesterday, I didn't get to finish the amount of work that I wanted to finish, which leaves me kind of like more stressed today because today I have to take care of my grandfather, which I've already fed him breakfast. I already cleaned the kitchen. I cleaned his room. I just need to get him ready now, and then I need to sweep and mop the floors, and I need to clean my room a little bit. So hopefully I can be done with that by 11 o'clock, and that'll give me from 11, 12, 1, 2, it'll give me 3 hours that I could work on my schoolwork. So at least I can finish the fluid and electrolyte modules, and then after I get back home from picking up my kids, then I'll hopefully start the ABG material. And if I finish all of the lecture stuff today, then that gives me all of, well, not all of tomorrow because I have to take care of my grandfather, but it gives me tomorrow to start working on all the prep views and the stuff like in course point and pass point, because on Thursday when we have lecture, we have our first actual lecture quiz, that proctored quiz, on the material that I'm learning now, if that makes sense. It is Monday night and it's like 10:30, and I got through the professor's lectures, but that was very difficult for me just because they were really boring and I just couldn't focus. I couldn't concentrate. I had to go pick up my kids from school around 2:30, and then when I got back, I made dinner and I had to finish like 1 or 2 more lectures from the fluid stuff, and I just couldn't focus. Like, I don't know, I just couldn't focus. Like, I watched all those videos, I took so much notes, and it's like I'm not comprehending what's being taught by the professor, which is similar to last semester as well. So I got through the fluid and electrolyte material, lecture, but I still have the ABG stuff to get through. And I also have to go through all of my lab stuff because we have a lab on Wednesday, and it is our like IV lab, and I'll show you guys like all the work we need to do for that.
Initiation of IV infusion. Outside the client's room. Jesus in me brand new clothes. We're still 32 below. Yeah. This is right side. Yeah. I just you love me and got you some good. It will be a lesson for another to be done. I keep you chasing and drunk what we're done. Oh, take it to the light like a stroll. Taking me to court like please don't ask again.
So on top of that stuff, I have clinicals on Friday, and of course we have like pre-work we need to do for that as well. And they gave us like a list of things that they want us to work on for our first clinical, and one of them is to like do an assessment on every patient that we're in contact with. I forgot how to do the assessment, so that's where we're at right now. Hopefully I wake up early in the morning tomorrow so I can go to the gym. I do need to take my kids to school in the morning, and I need to take care of my grandfather, and I need to get through the ABG stuff. Plus I need to get through the IV stuff for lab. And luckily my first like actual discussion assignment for my class at ASU isn't until the 8th. Thank God, because I don't know what I would do if it was due like within the next couple days. It is now Wednesday and I look like this because truly my eye hurts, and today I had school and I was wearing my contact lenses and my eye was so red and it was burning. This eye here, it was so red, it was burning. I switched my contacts around because I thought it was like just the contact that was irritating it, but then when I switched them around, this eye was still bothering me a lot. And yeah, it's bright outside and my eye hurts, especially this one. And yeah, now that I got my glasses on and I wink like this out of this eye, it's still blurry. So hopefully my contact is not making me go blind. But today at school we had lab and we practiced inserting IVs, and we have our IV practicum. I think I seen it is going to be on September 25th. So in about 4 weeks, we have our IV practicum. They gave us a document with the steps on it for our IV practicum. And there's like 60 steps. We have to get 80% or higher to pass. And I think they said each step was worth like 0.25, or each step is worth a quarter of a point. With that being said, I'm definitely going to start practicing for my IV practicum probably next week. Maybe on Monday I might go to the lab at my school and just practice there. Just because I don't want to wait till last minute and then just not do well on the IV practicum. So the sooner I get started, the better for me, the less stress it is. And I just want to make sure that I'm prepared and I'm not as scared as I was last semester when we had to do our med pass practicum. So last semester I failed the first time because I forgot to scan the medication. I verified the patient like verbally, but I didn't scan the medication. So I did the 3 checks or whatnot, but for the 3rd check, when I was about to give the patient the medication, I just verified that they were who they were, and I verified that against the MAR, but I didn't scan the medication. So I failed the first practicum last semester, and this semester I don't want to have to deal with the stress of failing again. So yeah, that's why I'm gonna just start practicing ahead of time. I just got to the gym. I'm gonna go do my little 100 flights of stairs, go home, take a quick shower, then I gotta go pick up my kids at school. And yes,
I was in my hovercraft, had enough.
Yesterday I was like legally blind in my left eye for the whole day. When I went to go pick up my kids from school, I got on the freeway and I almost merged into a car that I didn't see because only one of my eyes was working. So I decided not to finish filming, and I thought it would be smart to just focus on driving with my one eye. So today is Thursday, and I have my first official proctored quiz today. It is going to be on fluid and electrolytes plus ABGs. So yesterday, after I picked up my kids and I got home, I worked on ABGs, and I didn't even watch the professor's lectures that she posted for us, just because with the fluid and electrolyte lectures that she posted for us, those had me really confused. So I decided to not waste my time on listening to her with the ABGs. So I went on to YouTube and I found Nurse Mike from Simple Nursing, one of his videos on ABGs, and it was about 36 minutes, and I think it took me probably about 2 hours or a little bit more than 2 hours to take notes on it and like fully understand ABGs and like compensation, uncompensation, partially compensated, and like respiratory alkalosis, and then metabolic alkalosis and acidosis. So I got that down, and then after I finished Nurse Mike's videos and took notes on those, then I worked on the fluid and electrolyte prep use, and I got to mastery level 5. So fingers crossed that I do good on my quiz today. It's worth 5 points. So at my school, and I'm pretty sure probably at the other Maricopa schools as well, quizzes are worth 5 points. And then the exams, well, last semester my exams were worth I think 35 points, and now they're worth 40 points. So with my quiz, I'm hoping I get 100%. I'll be happy if I get 80%, as long as I don't get 3 out of 5. That is considered failing, because 5 out of 5 is 100%, and then 4 out of 5 is an 80%, and technically that's a C in nursing. So yeah, a 3 out of 5 would kind of be like failing. So I don't really know what my plans are for today. I know I gotta pick up my kids today at school. They get off at 3:15, so that means I gotta leave my side of town by 2:30 the latest, and I get off of school at 12. So I'm thinking I may go home, eat something after school, and then go to the gym, and then go home and quickly shower.
That's true, and the other thing is, my sister had a baby, and I took it over because she passed away, and then the baby lost its legs and its arms, and now it's nothing but a stump, but I still take care of it with my wife.
It is now 12:15, and I just left school, and my quiz went okay. I think I at least got 4 out of 5. I hope I got 5 out of 5, but I think I at least got 4 out of 5. Watch me get like 3 out of 5. That'd be hilarious. Not really, I'd be sad. I'd probably cry. We don't know our score until most likely tomorrow, because I think all of the cohorts have to finish before they can analyze the scores and release the scores, I guess. I will let you guys know what I got on my first exam, first quiz. I keep on saying my first exam because it's coming up. It is still Thursday, and I have like on my 3rd or 4th outfit for the day, because I ended up going to the gym, and then I had to go pick up my kids, and then I got my flu shot. And anyways, so I just received an email that the grades have been released for the quiz, and I'm not gonna lie, I'm a little bit nervous, so you guys will get to see me look at my grade. Here we go. My heart is beating fast. 4 out of 5. I'll show you guys. All right, there it is. I was a little sad because I wanted 5 out of 5, but oh well. I'll still be thankful and grateful. Good morning. It is 5:45, and it is Friday. I'm on my way to my Med Surg Clinical rotation. I am running a little bit late. I'm supposed to be there, well, we start at 6:30, but we're supposed to be there 15 minutes early, so I'm supposed to be there by 6:15, and it's 5:45 right now. It's going to take me 30 minutes to get there, so I should get there at 6:15, except for I have to stop and put gas in my vehicle, and I'm going to buy a coffee or an energy drink from the gas station, so I think I'll be on time, but I won't be there by 6:15. I'll probably be there by 6:20, 6:25 by the time I find a parking spot and get down. But yeah, I am on my way to my Med Surg Clinical rotation.
How you roll with them when you know I'm him? Got it on remote control. Got it on remote control.
parking at. And yes, my hair is down right now, but I have a hair tie on my wrist and I'm about to put it up once I get there. And then I also brought a headband, so I'll put my hair probably just in a ponytail and then I'll put my headband on. And I brought my laptop with me. I brought my clinical folder I made. I brought my stethoscope and then my little pen bag. I brought lotion, Tylenol, water, and my laptop charger. And I didn't bring my cell phone charger because it's fully charged. And yeah, so I'm excited, but I'm nervous to be here at the same time. My eyes are kind of getting a little bit watery because I'm just thankful I get to be where I'm at right now in this moment. So yeah. I plan on doing the most. Like, I want to do everything that I can do just because I want to get more experience. Because last semester, when it came to like skills and clinical and whatnot, I was mainly focused on passing my exams and quizzes. So I kind of like pushed the skill stuff aside. So I kind of am lacking a little bit when it comes to my skills. So this semester, I'm hoping to step it up. And yeah, that's where we're at right now. It is now Sunday and it's like 11:30 p.m. I just finished one of my assignments for my class at ASU, and I had a busy weekend with schoolwork. So after I got home on Friday after my clinical rotation, I wanted to work on some prep views, but as I was working on them, I was literally like falling asleep. Like, it was so hard for me to stay awake. I was so tired. I was so drained. Clinicals went good though. I wish I would have done more, but I was tired because Thursday night I had taken my dad to the hospital like at 9 or 10 o'clock. Once I did fall asleep, my dad called me like at 1 a.m. or 2 a.m. to go pick him up because he was being released from the hospital. They ended up giving him lisinopril, which is a Lasix or a diuretic, so hopefully he can get rid of his fluid retention that he has, and hopefully he can start feeling better. That's basically the reason why I was really tired on Friday. So once I got home from clinicals on Friday, I took a shower, and then my daughter had asked me if we can go to five and below, and I had told her yeah, but as I was doing my prep views, I was falling asleep. I think I only completed like 3 or 4 questions and I was like falling asleep. And then my daughter was like bugging and waking me up and asking to go to 5 and below. So finally I was like, okay, we'll go. That was around like 8:30 or 9. I got up, we went to 5 and below, and then we went to Sonic and I got a slushie. And then I was hoping that just getting up and waking up and like going to the store would help me wake up, and then I was hoping I'd be able to work on some more prep views when I got home, but that did not happen. I drank my slushie and I had a couple candies, and then I went to bed like probably by 11, so I didn't do much schoolwork on Friday. Saturday morning I went to the weight loss clinic and I lost 2 more pounds, which I'm happy about because I went to the gym like 3 times this past week, I think. So yeah, I lost 2 more pounds, which I was excited about. And after the weight loss clinic, I had to stop at my aunt's house. And then I came home and I started working on my prep views. Yeah, my exam's on Wednesday. So I was working on like a lot of prep use for the role of nursing. And I got to mastery level 8 on one of the prep use, and then I got to mastery level 6 on a couple, or like 2 or 3 of the other prep use. So basically on Saturday, all I did was prep use. So this morning I worked on more of the role of nursing, and I basically just looked at the objectives that we got on our blueprint for our upcoming exam on Wednesday. I looked at the objectives and I just basically answered them and make sure that I understood everything that was on those objectives for
Okay, they're actually
the
playing
role of
on
nursing. After I studied a little bit more of the role of nursing, I then went over the ANS medications again, which again, the ANS, what we are covering is the sympathetic nervous system and then the parasympathetic nervous system. So I watched some more videos on those topics. I took notes on like this giant piece of paper, and then I went into our pharmacology book and I answered questions that they have in our pharmacology book. And I got those questions from my pharmacology book, and then I placed those into a Quizlet. So I'm actually going to go over those medications again on Tuesday. So that's the day before our exam. After I went over the ANS medication and stuff, I worked on phlebotomy, and then I worked on IV. So I basically just went over those PowerPoints from our professors, and I watched them again. I skimmed through them. I took some more notes, and then after that I worked on IV calculations for a little while. Like, our professors gave us some worksheets to do last week in class and I didn't do them, so I completed those. After that, I had an assignment due for ASU, which was just a discussion post, like video introduction. So all we had to do was just record ourselves for 2 to 3 minutes and introduce ourselves and answer a couple questions. And then we had to do a discussion, like reply or post to someone else. So that was actually not due until the 8th, but I completed that. Well, our introduction was due today, but the reply wasn't due until the 8th, but I finished that as well. So here we are. I forgot to mention that our professors released a new module yesterday morning, which was Saturday, and I've only looked at it and it's so much material. So tomorrow I have to take care of my grandfather, but I should be done like around, I'm gonna try to be done around 11 o'clock. That way I can start working on my new module, because it is cardiac and there's a lot of information on it, and cardiac is like my worst subject in nursing school. Like, it's so difficult for me. I don't understand anything, and then there's like so much coursework for us to do. Like, there's like 5 prep U's they want us to do. There's like so many videos they want us to watch. This is like the most coursework that I had so far out of all the modules that we've done. I think we're on our 3rd module now. So yeah, that's my plan for tomorrow. Tomorrow is Monday, and I'm gonna wake up early and go to the gym. So my next video will start off tomorrow, but probably like in a couple weeks. So my next video will pick up tomorrow, and I'll be going to the gym early, taking care of my grandfather, and then spending like the rest of the day taking care of my kids and doing schoolwork. So tomorrow I'll be going over the new module stuff for our quiz on Thursday for the new stuff, and then we have an exam on Wednesday. For the exam is going to be on the role of nursing, the ANS meds and whatnot, and then IV, phlebotomy, There's a couple dosage calculation questions in there. And safe medication administration. So fingers crossed I get a good grade on my exam. I've been studying a lot. Anyways, if you made it this far, don't forget to like and subscribe to my channel. Other than that, I will see you guys soon. Bye bye.